Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to talk about serial cephalometric X-rays. And I know that's a mouthful, but what are serial cephalometric X-rays and when might you need them? So serial cephalometric X-rays basically means that you've taken more than one cephalometric X-ray over a period of time, maybe 6 months later, maybe 1 year later, and you're following up on some numbers. So obviously we have two slightly class 3 supplementary X-rays here. That's probably the indication where I'd be most likely to use them. Because anytime you have a class 3 malocclusion, skeletal malocclusion, your question is it going to get worse? And unless you have, you could look at the patient's age, get growth records, take a hand wrist X-ray, and be somewhat certain that the patient is done growing, but I would be more comfortable if I had a serial cephalometric X-ray that means 2 sets of cephalometric X-rays. Obviously, these are not the same patient, but they kind of could be. But this is, a mixed dentition class 3. This is a adult class 3. But just kind of showing you once the patient is done growing, your SNA, your SNB should not change. Your A and B should not change. So that is the position of the upper jaw and the lower jaw, respectively, relative to the cranial base, and the position of the upper and lower jaw to each other. So I want to see stability in the numbers. So whether you're using Steiner, which is usually what I use, I don't really care, McGann, POS, whatever, Sassoon, you want to see continuity in the numbers. And if you do, 6 months, then I'm feeling much more comfortable, especially if it looks like the patient does have an element of class 3 prognathism. That means the class 3 is due to a slightly big lower jaw as opposed to a slightly small upper jaw. The slightly small upper jaw will usually present earlier. The slightly big lower jaw will present later. In a boy, you might see that even up until age 21. In a girl, 15, 16, 17. So that's kind of some guidelines for you, because there's nothing worse than setting up a case, doing the treatment plan, and having the patient outgrow the treatment plan. That could be a liability for you if you hadn't predicted that and you hadn't done your due diligence. Not only might you have to retreat later for free, but you might have to give a refund, or if the patient needed jaw surgery, that might get significantly messier. So just make sure you are considering, in all class 3 going patients, doing a class 3 serial cephalometric X-ray. If it is phase 2, and if that will be the final set of braces or aligners, it might be a good idea just to hit pause a little bit on it. All right, thanks.